My name is Pascal Fries. I'm director at the Ernst Strüngmann Institute for Neuroscience in cooperation with Max Planck Society in Frankfurt am Main. I'm a medical doctor by training. I'm working as a brain researcher in fundamental brain research since many years. And in this context, we have been developing technology to record from many sites in the brain simultaneously and for a long period of time. And this technology development involved, very importantly, Professor Thomas Stieglitz from the University of Freiburg. And this also was one of the reasons why in 2020, last year, I became part of the Scientific Technical Advisory Board of CorTec. CorTec is active in the area of neurotechnologies. Now, the basic idea behind neurotechnologies has been around for a long time. Essentially, the idea behind these type of neurotechnologies is that the central nervous system, including the brain, is also an electric organ. It can be considered in many ways, but it can also be considered as an electric organ, because the nerve cells that are the crucial components of the central nervous system interact with each other through electric impulses. This electric activity can be measured, and it can also be influenced with electric stimulation, for example. And so this idea has been around for a long time, and it has enormous potential. Brain-related diseases are among the most important worldwide, yet the dominant medical approaches to treat these diseases have been very limited, simply because access to the human brain and the central nervous system in general is extremely limited. So the typical approaches are those everybody knows, including drugs. But drugs have limitations in the sense that they are often very unspecific in terms of the timing, and they're very unspecific in terms of where they act in the brain or the central nervous system. And this is very different for electrical recordings and stimulation technologies. They can be precise down to the millimeter, and they can be precise down to the millisecond. Correspondingly, this technology has been used. It has been used very successfully in the diagnosis and then the corresponding treatment of pharmacoresistant epilepsy, and it has been extremely successful in the treatment of pharmacoresistant Parkinson's disease, which is known as deep brain stimulation therapy. Yet, these very successful approaches so far have used rather outdated technology, or to put it in another way, since many years already, we have technology that could bring this area of medicine, this approach to the brain and the central nervous system, to a different level by making finer, more brain-compatible implants, by allowing them to go at more places in the brain, to stay in for a longer time without harming the brain or the central nervous system, and by having better ways of interfacing with it in real time, measuring and interacting at the same time. So there are technologies for this, and it is now the time to actually realize this potential. And I think this has been realized already a few years ago. And of course, in this area, it always takes some time to bring all the necessary parties together. And it seems to me that now, in recent years, this is really happening. So there is the technology. There is, on the side of the interfacing with the brain, there is technology on the side of making sense of the data, for example, using artificial intelligence in real time. And this is now coming together. And in that sense, I would indeed say it is now the time for neurotechnology to go from idea to implementation and application. CorTec has already brought modern technology into one aspect of all of this, and this is the interfacing with the brain. CorTec already implements modern technology to miniaturize electrodes to optimize the interface with the brain. So here, electrodes are produced that are thinner, finer, and able to interact with the brain for a much longer time without harming the brain. And they are already in clinical use. However, to realize the full potential of this, as I mentioned before, we have to be able to read this information in real time, make decisions on the basis of this, and then interact back with the brain in real time. And this is obviously an interchange with the brain, and therefore CorTec is currently developing the brain interchange technology. Neurotechnologies are already used very successfully in several areas of medicine. One example are cochlear implants that often allow children to learn, to hear, and to speak. Epilepsy, where implants are able to allow treatments that otherwise cannot be realized, and Parkinson's disease, where deep brain stimulation has been applied more than 150,000 times and often has been very successful. I personally am convinced that this is not the end, but there is a very substantial list of very important diseases that can be treated by neurotechnology. Already today, we know that major depression can, in some cases, be very effectively treated by stimulating the right places in the brain. And another very important example is obsessive-compulsive disorder. These diseases are extremely important. They are often chronic, and they are often not only devastating for the patient, but for the entire social environment. So, for example, major depression is not only one of the most important psychiatric diseases, it's one of the most important diseases worldwide in general. One very important aspect here is that the application of neurotechnology is always a major medical, typically also involving surgical intervention on the patient. Therefore, ethical medical standards have to be extremely high. I would like to argue that if we do this right, as we do it in many other areas of medicine, if we have the highest medical and ethical standards, then we should and we can actually also use the full potential of neurotechnology. So in my view, we have actually a moral imperative to do it right in order to realize the full potential for patients.